Hello, my name is Lindsay Oros. I'm a physician assistant at the Virginia Spine Institute. And today I have with me Dr. Neda Hashemi to shed some light on the importance of women taking charge of their health. Welcome, Dr. Hashemi.
Hi, welcome. Thank you.
So, for those of you who don't know Dr. Hashemi, she is a busy obstetrician gynecologist at Reston Women's Center, and she's on call today, on call this week, and joining us. And we just really appreciate your time. So, welcome.
Thank you.
Today, together, and I honestly can't think of a better person to recognize International Day of Action for Women's Health. And, I think this day has meant a lot of different things to a lot of different groups of women with a lot of different issues. But today we're going to be discussing why 2021 is the year for women to put their health at the top of their to-do list. And as women, we do tend to put our families first and our careers first. And as you know, even the patients oftentimes come first. And so we're really going to make an effort to put ourselves first. How long did you wait before you came in?
First of all, Dr. Good saved my life, no question. 100% he saved my life. But I guess I thought that I was just getting older. I was gaining weight. I can't exercise. My back hurts. My job is difficult. So maybe it's just normal. And, who doesn't take an Advil every day, all the time, just to go to the grocery store? I just thought that was normal. And ignore it because there's so many other things going on. Back pain can't be very important. And it wasn't until my husband, who is a surgeon, saw a CAT scan and saw a little bit of my spine and said that I think that there's something wrong, and ordered an MRI for me, and then took it straight to Dr. Good and said, look at this. And they called me into the office and said, listen, you have this congenital defect in your spine that you've had since childhood probably. And how are you living? And I'm like, I don't know. And he said, this is almost an emergency. So I was very fortunate that I got in quickly, had the procedure, and I just didn't realize what I was living with before. It is like when you wear glasses for the first time and you're like, oh, everything is clear. Right. I didn't know that you don't have pain getting up out of bed. I didn't know that getting in and out of a chair is not supposed to be painful, or standing and washing your dishes, or bending over, you're not supposed to have pain going down your leg. I didn't know that. I just thought it was normal.
Oh my gosh.
So I guess I was living with it for my whole life, and you just adapt to it. Right. But one day, if it had been caught any later, it would have been completely catastrophic. And I'm just, I'm just so thankful. I mean, he gave me a life that I didn't know I could have. I started exercising, I lost weight, and I cannot even tell you that how he changed my life.
And I think that's such a great testament to, listen to your body when something is persistently wrong, just get it checked. If it is just run of the mill, then it's run of the mill. And if it's something like you had, where it's a bad problem and can really get improved upon, then you get your life back even sooner. I mean, would you tell the person watching, get your life back sooner?
I do. And I also think that we're scared sometimes to know. I think sometimes we know something is wrong, and I think we're scared because who's going to pick up the kids? Who's going to take care of the job? Who's going to do this? Who's going to do that? I mean, things are going to get done. And we always put ourselves last. That's because everybody comes first before the mom. But if you remember when you're on an airplane and the airplane's going down, the first thing they do is they say, take the oxygen mask and put it on yourself first. Give yourself oxygen. If you don't help yourself, you cannot help anybody else. It's the same thing. The mother, the wife, the woman, she is the center of the home. She is the sun of that solar system. And if she goes down, everybody goes down. So it is the year for us to start paying attention to ourselves. It's not selfish. It's actually purposeful. It's to help not just ourselves, but to help everybody around us. Because if we break down, everybody breaks down.
Thank you so much for sharing both your professional recommendations, your personal recommendations and story. I mean, I think you're just, again, the perfect person for us to highlight International Day of Action for Women's Health. And I would encourage all the women out there watching to open up the chat box and type in one thing they're going to do this year for their health. Maybe you're getting that mammogram, or maybe you're getting blood work. Type in something, or if you've already taken action and you've already done it and there's been, something good that's come of it, share that with all of us, and we'll all just continue to encourage each other and really try to be better this year.
Definitely. Thank you so
Thanks,
much.
thanks
Thank
everyone.
Bye.